signs it's twins. Bigger and earlier baby bump. One big clue that mom-to-be could have two little bundles of joy growing inside of her is her stomach being a little bigger than average at the beginning of her pregnancy. No, she is not putting on extra weight from those salty or sugary food cravings, but is due to the fact there are two little babies growing inside of her instead of one. How exciting, but sometimes mom can worry. Will they have room to grow? Will they develop alright? Will there be other problems in utero? Yes, sometimes with multiple certain risks do go up, but yes, from the beginning the babies have enough room to develop in utero and nature will take care of things and help them develop separately and bond together. The woman will also be monitored very closely if twins are suspected, so that any related medical issues can be taken care of and baby and mom will fare the best way possible. Pregnancy symptoms are more intense. Yep. Nausea, tardiness, vomiting, bloating. The usual, but now times 2. This is what a lot of women pregnant with twins may sometimes experience a lot more of. Thankfully, as in single pregnancies, it is usually temporary and only lasts the first few months as a woman's body adjusts to the pregnancy. She may also be hungrier and more emotional than usual. These are just general guidelines though. Some women won't notice anything or some will have more intense symptoms even with one baby growing inside. But it is important if she has unusually intense symptoms to check with her obstetrician and follow up with her medical team. They will follow her more closely to make sure no complications develop, as sometimes in twin pregnancies this does occur. Chances are excellent that she and babies will be fine however. In today's day and age with multiple pregnancies happening more often, there are great medical breakthroughs to help the woman if problems do develop even early on. Blood tests confirm it. Keeping in mind the symptoms of both signs above as well as a positive pregnancy test, she now knows she is definitely pregnant. But the pregnancy test will not test for twins or multiples. The only way she could know if the pregnancy is a twin one is by doing a blood test. The pregnancy blood test will confirm the pregnancy and will give a pretty accurate result to tell her if the pregnancy is with multiples. How will she know this? The HCG level will be higher. This is usually in conjunction with having more than one body growing inside her. This test will most likely give confirmation to the woman that she will be the happy mama of 2 babies in 9 months' time. From that point onwards, she will get extra attention and medical care to make sure both babies are developing normally and that there are no difficulties. The girls become extremely tender. Yes. Breast tenderness, or rather extra breast tenderness, can indicate another little future cutie patootie growing inside of her. Many women, pregnant or not, have dealt with this unpleasant side effect every month when it is their menstrual cycle either before or during their cycle. Well, this same side effect happens when they are pregnant, and may start even earlier in twin pregnancies than in single ones. It can be really uncomfortable. The best thing the woman could do is make sure to eat well, and make sure she is not retaining too much water. This will help with swelling. The other thing she could do is make sure she has a good maternity bra or two. This will give her breasts the support they need to feel comfortable, and she can go about her activities with no issues. This will help decrease any discomfort or pain as well. While she is shopping for maternity bras, she needs to also consider buying some nursing ones if she is planning on breastfeeding. Extreme intolerance to certain foods. In pregnancy lots of different side effects occur. One of them is intolerance to certain foods. Sometimes these are foods that the woman loved, like coffee, chocolate, meat. These can be so intense that even thinking about them can make her want to vomit or even gag. The smells of these foods can cause gagging, nausea or sickness. She also could develop allergic reactions to certain foods like rashes or other kinds of symptoms. Now in a single pregnancy, these symptoms can be intense at times too, but usually they are not that bad and fade out after 3 or 4 months. With a twin pregnancy, they can stay for longer, sometimes midway through pregnancy, and the intensity is stronger so that it may take her body longer to recover from a bad food experience. This is another sign she could be expecting 2 babies in the future. Of course this happens in single pregnancies too, but is a lot less common. Uterus just keeps getting larger. This next sign is generally only visible to one's obstetrician, midwife or medical care practitioner. They will measure her uterus on regular prenatal visits and will pretty much see right off the bat if her uterus is very large for the month she is due. Of course, other reasons will be ruled out for this as well, but the most common reason is a safe and exciting one. It is due to her carrying more than one baby. A family history will be taken as twins tend to run in families. The couple will also be asked if the doctor is new to the team, if they have done IVF treatments, as this is another common way women become pregnant with twins. The sooner her medical team knows she is pregnant with twins, the sooner she and her babies can receive the best medical care possible. There are risks to babies and moms in twin pregnancies, but if mom is in the best possible health and is being closely monitored, all will work out fine. Needing to pee more than usual. Yes. All of us who have been pregnant remember how the first thing most of us did when we got to a new place was ask where the bathroom was. After all, in an hour's time, we would need to visit that facility at least 5 times. Now some women need to pee more than others, and of course it is recommended women drink a lot of water to stay hydrated and fight off bouts of nausea. This, well, kind of exacerbates the problem of peeing. However, even with that, if the woman's water consumption is not super high, and it seems she is never leaving the toilet facilities and pretty much has to set up shop in there, it may mean that 2 babies and not 1 are growing inside of her. She'll have to watch her liquid intake and adjust her work and social schedule around that, and know that all the temporary inconvenience is well worth it. At the end she will have 2 wonderful gifts to take home. More emotionally unstable. Hormones pretty much have their ways with us women from puberty onwards. Of course, this does not mean that women have no control over their bodies and minds. It is just that they need to be aware that hormones do fluctuate with their menstrual cycles and in pregnancy as well. There are times they will be feeling super emotional and other times they are feeling in control. However, in a twin pregnancy women can feel more unstable and more prone to tears as those hormones kind of run around haywire in their bodies. It is not their fault. A lot is happening to grow those 2 little lives inside of her. She needs to take care of her mental and physical health. If ever she feels her emotions are out of her control to handle, she should not hesitate to speak to her doctor about what other kind of help is out there.